A comprehensive guide to lowering your prescription drug costs. For many Americans, the soaring cost of prescription medications creates a significant barrier to achieving and maintaining good health. Whether you're uninsured, underinsured, or grappling with rising copays and deductibles, securing the medications you need shouldn't force you to choose between your health and financial stability. The good news is that a robust network of assistance and discount programs exists to help alleviate this burden. This comprehensive guide outlines the various types of aid available, provides detailed steps to access them, and includes recent policy changes, practical tips for overcoming application challenges, and resources for those with limited digital access. By understanding and utilizing these options, you can take control of your prescription costs and ensure better health outcomes. Understanding your options. Prescription drug assistance is available through 4 primary categories, each with its own eligibility requirements and benefits. The table below offers a quick overview to help you identify the best starting point for your needs. Program type. Who qualifies? Key benefit. Where to start? Generic/therapeutic substitution. Anyone. 50 to 85% cheaper than brand name drugs. Doctor or pharmacist. Patient assistance programs, PAPs. Low income, uninsured/underinsured. Free or low cost brand name/specialty drugs. NeedyMeds.org, RxAssist.org. Discount cards. Anyone. Discounts at participating pharmacies. GoodRx.com, SingleCare.com. Government programs, e.g., Extra Help, Medicaid. Low income, Medicare/Medicaid eligible. Reduced premiums, deductibles, copays. Medicare.gov, Medicaid.gov. One, low-cost alternatives, generics and therapeutic substitution. One of the most immediate and effective ways to reduce prescription costs is to opt for non-brand name medications, which can significantly lower your out-of-pocket expenses without compromising treatment quality. Generics. These are exact copies of brand name drugs, containing the same active ingredients, dosage, strength, and route of administration. They must meet the same rigorous FDA standards for safety, efficacy, and quality as their brand name counterparts. 17. The primary difference is cost. Generics are typically 50% to 85% less expensive, making them a highly cost-effective option for many patients. Therapeutic substitution. This means switching to a different drug that treats the same condition but may have a different active ingredient. For example, if you're prescribed a brand-name cholesterol drug, your doctor might suggest a different, lower-cost cholesterol medication that works similarly. This approach, often preferred by insurance plans, requires careful discussion with your healthcare provider to ensure the substitute is appropriate for your condition, as differences in side effects or efficacy may occur. Alternative type. Description. Key benefit. Generic drug. Bioequivalent copy of a brand name drug with identical active ingredients. Lowest cost option, FDA approved for safety and efficacy. Therapeutic substitution. Different drug treating the same condition, e.g., a different cholesterol medication. Cost-effective alternative within a drug class, often insurance preferred. Action. Ask your doctor or pharmacist if a generic or therapeutic substitute is available for your medication. They can also guide you on whether the substitute will meet your medical needs effectively. Two, patient assistance programs, PAPs, and charitable aid. Patient assistance programs, PAPs, and charitable aid programs are vital resources for accessing free or low-cost medications, particularly for expensive brand name or specialty drugs. What they are: PAPs, often sponsored by pharmaceutical manufacturers, provide free or discounted medications to eligible patients, focusing on brand name and specialty drugs used for complex conditions like cancer or rare diseases. 2. Some PAPs are managed directly by drug companies, while others are operated by independent charitable foundations that receive funding from manufacturers or other sources. Eligibility. Eligibility is primarily based on income, often measured as a percentage of the federal poverty level, FPL, such as 200% or 300% FPL, which varies by household size. 3. For example, in 2025, 300% FPL for an individual is approximately $45,180 annually. These programs typically consider income rather than assets like savings or retirement accounts, e.g., 401k, IRA, making them accessible to patients with modest savings but low current income. Manufacturer-sponsored PAPs generally cannot assist beneficiaries of federal programs like Medicare Part D due to regulatory restrictions. 4. However, independent charitable foundations, such as the PAN Foundation or HealthWell Foundation, often have programs specifically designed for Medicare enrollees. Funding limits and waitlists. Charitable programs may face funding shortages, leading to temporary closures or waitlists. For instance, the PAN Foundation may close funds for certain diseases when depleted, but patients can join waitlists to be notified when funding reopens. 5.24. Apply early in the funding cycle and check availability regularly. Since eligibility and funding availability can change, visit websites like NeedyMeds.org, panfoundation.org, or healthwellfoundation.org, or call the programs directly to confirm the latest details. If you encounter a waitlist for programs like the PAN Foundation or HealthWell Foundation, consider alternatives such as Accessia Health, the Assistance Fund, TAF, Cancer Care, or Good Days, which offer similar grants for copays, premiums, and medications, often tailored to specific conditions. These organizations can provide interim support while waiting for primary funding to reopen, and many have online portals for quick eligibility checks. Appealing PAP denials. If your PAP application is denied, you have the right to appeal the decision. Contact the program directly to understand the denial reason, e.g., incomplete documentation or income verification issues. Gather additional documents, such as updated income proof or a letter from your doctor confirming medical necessity, and resubmit your application. Websites like NeedyMeds.org provide guidance on navigating PAP appeals, and some programs offer appeal forms or hotlines. Persistence is key. Check with the program for specific appeal processes and deadlines. Resources. NeedyMeds offers detailed guides on PAP applications and eligibility. PAN Foundation and HealthWell Foundation provide financial aid for copays, deductibles, or premiums for specific conditions. (3) Prescription drug discount cards and direct-to-consumer pharmacies. For those seeking immediate cost reductions without complex applications, discount cards and non-profit pharmacies offer accessible solutions. Since prices and availability can change frequently, always check websites like GoodRx.com, SingleCare.com, RxOutreach.org, or CostPlusDrugs.com for the latest discounts and drug options. Discount cards. Free tools like GoodRx, SingleCare, ScriptSave WellRx, and Amazon Pharmacy provide discounts on prescriptions at participating pharmacies, available to everyone regardless of age, income, or insurance status. 5. These platforms allow you to compare prices across pharmacies to find the best deal for your specific medication. For example, a 30-day supply of a generic drug might cost $10 at one pharmacy and $25 at another. Emerging options like RxSaver, BuzzRx, and America's Pharmacy expand your choices, offering savings up to 80% on thousands of medications and additional features like telehealth discounts or price alerts. Compare multiple apps to maximize savings, as prices can vary by tool and location. Manufacturer coupons/copay cards, offered by drug companies. These reduce copays for specific brand name drugs, such as Jardiance or Farxiga, typically for patients with commercial or private insurance. 6. Savings can be significant, e.g., up to $175 per 30-day supply for Jardiance, but annual caps apply. 16. Critical caveat: copay accumulators. Some insurance plans use copay accumulators, which means the savings from manufacturer coupons don't count toward your annual deductible or out-of-pocket maximum. For example, if you use a coupon to save $100 on a drug, that $100 won't reduce your deductible, so you may face higher costs later when the coupon's limit is reached. Check your insurance policy or contact your plan to confirm if accumulators apply. Nonprofit mail-order pharmacies. Organizations like Rx Outreach and Cuban Cost-Plus Drug Company use simplified supply chains to offer generic and some brand-name drugs at transparent, low prices, often bypassing insurance entirely. 18. These are excellent options for the uninsured or those with high-deductible plans, as prices are often lower than insurance copays. Resources: GoodRx, SingleCare, ScriptSave WellRx, Amazon Pharmacy, Rx Outreach, Cost Plus Drugs, RxSaver, BuzzRx, America's Pharmacy. 4. Government-sponsored programs, federal and state. Government programs provide critical support for low-income individuals, Medicare beneficiaries, veterans, and others, offering comprehensive drug coverage or subsidies. Since eligibility criteria and income limits can vary by state or change annually, always verify details on program websites like Medicare.gov, Medicaid.gov, or VA.gov. Program Overview. Eligibility details. Special note: Medicare Low-Income Subsidy, Extra Help. Subsidizes Part D premiums, deductibles, and copays for Medicare beneficiaries. 8. Income up to $23,475, individual, or $31,725, couple, asset limits of $17,600, individual, or $35,130, couple, including retirement savings like IRAs and 401(k)s, higher limits in AK/HI or for larger families. 15. 22. Must be enrolled in Medicare. Apply at Medicare.gov. Medicaid. Joint federal-state program covering prescriptions for low-income individuals. 9. Income-based, MAGI rules, e.g., 138% FPL in many states. Asset tests may apply for elderly/disabled or long-term care recipients. Eligibility varies by state. Check at Medicaid.gov. State Pharmaceutical Assistance Programs, SPAPs. State-run programs filling Medicare Part D gaps or aiding the uninsured. 10. Varies by state, e.g., age 65 plus, income-based. Examples: Pennsylvania's PACE, New Jersey's PAAD. Find state-specific programs at benefitscheckup.org or medicare.gov. VA/TRICARE. Comprehensive drug coverage for eligible veterans and service members. 19, 20. Based on military service or disability status. VA offers prescriptions for $5 to $11, even for non-service-connected conditions if enrolled. VA requires prescriptions from VA providers. Visit va.gov. Expanded details on SPAPs. Approximately 20 states offer SPAPs, which often provide wraparound coverage for costs not covered by Medicare Part D, such as premiums, deductibles, or specific drugs. Eligibility varies, but common requirements include age, often 65 plus, residency, and income limits. For example, Pennsylvania's PACE/PACENet, available to residents 65 plus who have lived in PA for at least 90 days, not receiving Medicaid prescription benefits. Income limits for 2025, PACE, $14,500 or less, single, $17,700 or less, married, PACENet, $14,501 to $33,500, single, $17,701 to $41,500, married. Benefits include low-cost prescriptions, often $6 to $15 copays. New Jersey's PAAD, for NJ residents 65 plus or 18 to 64 receiving Social Security disability benefits, not eligible for Medicaid. Income limit for 2025, less than $53,446, single. Benefits cover most prescription costs with a $5 to $15 copay. Check your state's program for specifics, as some target chronic conditions like HIV. Recent policy changes. The Inflation Reduction Act, 2022, has introduced significant reforms to reduce drug costs for Medicare beneficiaries. Starting in 2026, negotiated prices for 10 high-cost drugs, e.g., Eliquis, Jardiance, will take effect, with additional drugs negotiated in 2025 for 2027 implementation, 1/23. This could lower out-of-pocket costs for Part D enrollees. Check your plan's formulary for updates. 5. Overcoming insurance hurdles, prior authorization and step therapy. Even with insurance, administrative barriers can delay or deny access to costly medications, requiring proactive engagement with your healthcare team. Prior authorization, PA, a cost control measure where your health plan requires your doctor to obtain approval before covering a specific drug, verifying its medical necessity, 21. If denied, your provider must submit detailed paperwork, including medical records or evidence of need, which can be time-consuming. Step therapy, fail first, requires trying one or more lower-cost, often generic, drugs before the plan covers the prescribed, higher-cost medication, 21. This can delay effective treatment or cause side effects, particularly for chronic conditions like diabetes or mental health disorders. For example, failing on a generic antidepressant before accessing a brand-name drug may prolong symptoms. Document any adverse effects or ineffectiveness to strengthen appeals for the preferred drug. Appealing insurance denials. If your insurance denies coverage due to prior authorization or step therapy, you have the right to appeal. Contact your insurance provider to request an appeal form or process details, and work with your doctor to submit evidence, such as medical records or a letter explaining why the prescribed drug is necessary. For Medicare Part D enrollees, visit Medicare.gov for appeal guidance, including timelines, e.g., 60 days to file an appeal. For other plans, check your policy or call your insurer for specific appeal procedures. Resources like NeedyMeds.org or your state's insurance commissioner can offer additional support. Your action: work closely with your doctor's office, which initiates PA or step therapy processes. Provide a detailed medical history, including previous failures on alternative drugs, to support your case. Learn more about navigating these hurdles at AMA. Your action plan for finding assistance. Navigating the landscape of prescription assistance can feel overwhelming due to complex applications, potential rejections, or delays in approval. By being methodical and persistent, you can increase your chances of success. If you lack internet access or digital skills, local resources can provide hands-on support. Consult your healthcare team. Your doctor or pharmacist is your first point of contact. They can recommend generics or therapeutic substitutes, identify PAPs for your specific medications, and assist with the medical documentation required for applications. 11. Many hospitals employ social workers or patient navigators who specialize in helping patients access assistance programs, including completing complex paperwork. Utilize online databases and nonprofit pharmacies. use free, comprehensive online resources to search for assistance programs by drug name or condition. Always check these websites for the latest eligibility requirements and pricing, as program details can change frequently. NeedyMeds offers detailed eligibility and application information for PAPs. RxAssist provides a database of manufacturer and charitable programs. GoodRx compares pharmacy prices and offers discounts. SingleCare, another discount card option for competitive pricing. RxOutreach, non-profit pharmacy with low-cost generics. Cost Plus Drugs, transparent pricing, ideal for uninsured patients. Connect with charitable and advocacy nonprofits. National organizations provide financial aid for specific diseases or general prescription costs. PAN Foundation and Healthwell Foundation offer assistance for copays, deductibles, or premiums, but check for waitlists due to funding limits. 13. NCOA Benefits Checkup helps older adults and people with disabilities find programs for health and drug costs. 14. Prepare application essentials. When applying for PAPs or government programs, gather proof of income, e.g., tax returns, W-2s, pay stubs. Insurance details, e.g., plan formulary, deductible, copay amounts. Prescription or medical documentation, such as a written prescription or a physician's statement confirming medical necessity. 15. Be prepared for potential delays or requests for additional information, and follow up regularly. Address digital barriers. If you lack internet access or struggle with online tools, seek in-person assistance. Call 1-800-Medicare 1-800-633-4227 for guidance on Medicare programs. Visit a local pharmacy, where pharmacists can help identify discounts or programs. Contact area agencies on aging for local support, especially for seniors. Use community health centers or public libraries, which often provide free computer access and staff assistance for applications. Quick reference guide. The table below summarizes the key ways to lower your prescription drug costs, making it easy to find the right option for you. Always check listed websites or contact programs directly for the latest eligibility and pricing details. Option. Who qualifies? Key benefit. How to start. Generic/therapeutic substitution. Anyone. Save 50 to 85% with generics or alternative drugs. Ask your doctor or pharmacist about generics or substitutes. Patient Assistance Programs, PAPs. Low income, uninsured/underinsured. Free or low-cost brand name/specialty drugs. Visit NeedyMeds.org or RxAssist.org, check for updates. Discount cards. Anyone. Up to 80% off at pharmacies. Use GoodRx.com, SingleCare.com, or similar apps, verify prices. Government programs. Low income, Medicare/Medicaid eligible, veterans. Reduced premiums, copays, or $5 to $11 prescriptions. Apply at Medicare.gov, Medicaid.gov, or VA.gov, confirm eligibility. Final takeaway. The high cost of prescription medications is a systemic challenge, but a wide array of assistance programs, from generics and discount cards to government subsidies and charitable aid, exists to help you afford the treatment you need. Stay informed about recent reforms like the Inflation Reduction Act, which may lower costs for Medicare beneficiaries, and be persistent in navigating application processes. If digital access is limited, leverage local resources like pharmacies or community organizations. By taking a proactive, methodical approach and utilizing the resources outlined in this guide, you can reduce your prescription costs and prioritize your health. References.